Hello, everybody. Good evening, everyone, and welcome to our Facebook Live session. My name is Gary, and I'll be your host for tonight's live session. So, firstly, before we begin, I'd like to introduce to everyone our new Facebook Live or our 365 Live logo. So, every time you see the 365 logo, you're going to know that we are live, where we educate the public on cancer and encourage cancer prevention lifestyles. So whenever you see this logo, you'll know that 365 Cancer Prevention Society is currently having a live broadcast like this evening. I would also like to introduce the organizer for the event tonight and the co-organizers too for tonight's talk. So this talk is specially brought to you by 365 Cancer Prevention Society and co-organized by OncoCare Cancer Center. So a little bit about 365 Cancer Prevention Society. If you haven't heard, we were founded in 2003 as a social service agency with an IPC status, so we are a fully fledged member of the NCSS. So the Society's mission is to serve the community through holistic cancer prevention measures. So we do this in multiple ways. There's health and nutrition education, like this evening, promotion of healthy lifestyles, and of course, our lymphatic detox exercises. If you haven't seen what they are, please do check out our Facebook page to learn more. We also provide practical and emotional support and care for our members and their family members in their battle against cancer through our residential and hospital visitations, our counseling services, nutrition consultation, and wellness services too. So again, please connect with us through our social media pages, like, share, comment, and keep up to date with our latest events and activities. Also, please do check out OncoCare Center's website and Facebook page for more details about them and learn more about how we can help each other to stop cancer. Also, before we begin, I would like to introduce a campaign we are currently running. It's called Stay Clear of Gastric Cancer. So if you don't know, gastric cancer or stomach cancer, as you might know it more commonly, is a common cancer in Singapore. Hence, here at 365 CPS, we have launched a Stay Clear of Gastric Cancer to raise funds for individuals who are over 40 from low-income backgrounds to go for a sponsored gastric cancer screening. And this includes pre- and post-consultations. So this screening will only involve drawing of blood, blood sample, and it will allow for early detection of gastric cancer and early treatment too. So there's many donation tiers. They start from $10 and go all the way up to $100 or even $200. So right now, if you don't mind, please do take out your phones, take a picture of this slide that you can see on your screen right now, or you can scan the QR code and make your first donation. There may be a link that you can see also in the comments section. And if you are able to, please support, because your donation is going to go a very, very long way in helping a beloved family member and cherished friend to receive the early prevention and of course the treatment, if required, that they need to survive this cancer. And of course, if you do right now, I'll give you just a little bit more time to go and make your donation. But if you do hit the higher tiers, you will see that you are actually donating a full screening, including the pre and post consultation. So just spend another moment, if you don't mind, just to help out our fellow humans. I also want to quickly thank our technology partner, Mirexis, as well as our supporting partner, StarMed Specialist Center, for making this gastric cancer screening possible. And of course, not to forget our community partners for coming on board to raise awareness for our campaign and identify eligible beneficiaries. So tonight we are here for pancreatic cancer. But before we begin, please note that all the information shared here at this event by our speaker and 365 CPS is for general information only and are subjected to changes. So please, if you do need to, consult your doctor for personalized, detailed medical advice. Also, sometimes, due to the nature of this talk, there could be some graphic images shown in the presentation. So, please just be advised on that as well. All right, so if you don't know, November is Pancreatic Cancer Awareness Month. And we want to raise awareness for this fairly common but aggressive form of cancer. So today, our special guest will be covering some of the risk factors for pancreatic cancer, the role of health screenings, some early signs of pancreatic cancer that we can catch so that we can address it. So the treatment options as well for patients who are diagnosed with pancreatic cancer. And of course, we have chosen one of the best experts to hear from. So our speaker this evening is a senior consultant medical oncologist from Onco Cancer Center. She's had more than 12 years experience in the diagnosis and management of a wide range of cancers. Her specialties do include gastrointestinal cancers, so that's where pancreatic cancers are, among others like colon and gastric cancer too. And she also has experience in geriatric oncology, and you'll find out why that's important too. So our speaker was also an investigator for several international pancreatic cancer clinical trials, and her research has been published in many high-impact peer-reviewed journals, and that is why we've invited her to speak to us this evening. And I assume that's exactly why you are here too. So it is my absolute pleasure to introduce to you Dr. Angela Pang. Please.
Hi. Good evening,
Hello.
everyone. Hi, Gary. Thank you for the very kind introduction. And
Not a problem. Dr.
yeah.
Pang, thank you so much for joining
Mhm,
us this Saturday evening to share with us your knowledge and advice and to all of us here
mhm.
about pancreatic cancer.
Yeah,
So I
definitely.
do
Mm.
hear that pancreatic cancer is far more common in older adults. Is that right?
Yeah, that's actually very true. I mean, in fact, the risk of pancreas cancer actually increases in people who are 45 and above. And essentially, the older you are, the higher the risk. But it's not everyone gets it. It's just that as you get older, the risk gets higher. So
So
that's
so
true.
is there something we can do, or how do we know, or what? Yeah.
Yeah, so I mean, as with most cancers, prevention is better than cure. So, if we can reduce or reverse some of the risk factors that are associated with pancreas cancer, we can definitely reduce our risk of developing pancreas cancer, which is what we would be more or less covering tonight as well. A
Yeah,
bit
I
more,
was just about to ask that.
yeah,
Reversing risk factors sounds very important.
yeah,
Are you covering that tonight?
definitely, definitely, very
Definitely. Okay,
important.
fantastic. All right. Well, I'm so looking forward to this. I'm going to hand the time over to you right now, Dr. Pang. So
Sure.
please take it away. Thank you.
Thank you, Gary. Okay. Good evening, everyone. Thank you for spending your Saturday evening listening to our talk. As Gary mentioned, this is the November is the Pancreatic Cancer Awareness Month. So we really want to touch on a little bit more about this form of fairly common but very aggressive form of cancer known as pancreatic cancer. So the purple ribbon is actually a logo that helps us stay aware of the different types of cancers. And purple ribbon actually is consistent with promoting awareness for pancreatic cancer. And there we have here. So a bit of overview of what we're going to be covering tonight. I will be talking about the different types of pancreas cancer. And as Gary had mentioned and alluded to earlier, we would be covering the risk factors and what can we do to reduce our risk of developing this form of cancer. And really, nowadays, there are many different forms of health screening. And is health screening actually effective for reducing or for picking up pancreas cancer early and so on? And also, what are some of the common signs and symptoms that we can watch out for, if for ourselves as well as for our loved ones around us? If we do suspect that they do have early signs, maybe they should see a doctor earlier. And also, we would also be covering a little bit about some of the common investigations done for patients who are diagnosed with pancreas cancer and what is the current management options available, as well as what are some of the novel treatment options available for patients with pancreas cancer. So, a little bit of background on statistics and numbers to kind of highlight why it is important for us to understand about pancreatic cancer. So, pancreatic cancer is really like the third leading cause of cancer-related death in the USA, and that is pretty high considering the fact that pancreatic cancer is not even within the top 10 cancers in the USA. And similarly, it is also not within the top 10 cancers in Singapore, but it is the fifth or sixth cause of cancer-related death. So that kind of goes to show that it's a fairly aggressive form of cancer, and really stage 4 stage pancreatic cancer, unfortunately, still has one of the most devastating survival rates of any major cancer type. And that is also partly because the vast majority of the patients do present late. More than 80% of them are actually inoperable. That means they're not amenable to surgery at the time of diagnosis, which kind of brings us to the point why understanding your risk factors, reducing your risk, and perhaps picking up early if you do have a high risk is very important. So this is maybe a little bit more about the science part of pancreatic cancer. So what a lot of people do not know is there are at least two big groups of pancreatic cancers. And as with most cancers, the origins of the cancer is actually what brings about the fact that they are different. So majority of what we know as pancreatic cancers, about 93% of them are what we call exocrine tumors. The cell type of pancreatic cancers is known as adenocarcinoma, and this is the type that we commonly know. We also do know that Steve Jobs, who is the founder of Apple, he also had pancreatic cancer, but he did a lot better than a lot of other patients with typically we know with pancreatic cancer, mainly because he had the rarer form of pancreatic cancer, which was known as the neuroendocrine form of pancreatic cancer. So these are fairly rare, and they do. Some of these neuroendocrine tumors they produce excessive hormones because the pancreatic organ also produces quite a few types of hormones, of which one of the more common hormones that we know is known as insulin. So if let's say this is a neuroendocrine tumor that produces a lot of insulin, it is known as the insulinoma. I mean, this is just kind of good to know. So down to the important point about recognizing. So recognizing the risk factors for pancreatic cancer is actually very important, especially since most of the members of our audience may be people who do not have pancreas cancer or are family members. So there are some risk factors that are not something that we can change. I mean, we can't change our age, we can't change our gender. But the next slide, we will talk about what are some of the potentially correctable kind of risk factors. So as we mentioned earlier, age. So the risk of pancreatic cancer, unfortunately, actually increases with age. As you get above the age of 45, the risk increases. And in fact, 90% of all pancreatic cancer patients are more than 55, and 70% are actually even older. So as you get older, the risk is actually higher. Gender-wise, it's unfortunately more common in men. Race and ethnicity, fortunately in Asia, our risk is a little bit lower because pancreatic cancer is more common in Black people compared to Asians, Hispanic, or white, and also a particular Jewish group of patients, people with a Jewish Ashkenazi heritage are also at a higher risk. And also, unfortunately, some people may have a hereditary, that means a strong family history of pancreatic cancer, and pancreatic cancer runs in their family, or they may have a genetic condition that can increase their risk of pancreatic cancer as well as others. So these are some of the factors that we may not be able to change, but it's kind of good to know. And what are the important potentially reversible risk factors that we can take the proactive approach to change? Smoking. So smoking does not just increase your risk of lung cancers, it also increases your risk of many different types of cancers, including pancreatic cancer. So people who smoke are actually at 2 to 3 times higher risk of developing pancreatic cancer, and also obesity, poor diet. So, for example, people who take high fat intake and who are obese are actually at a higher risk of being diagnosed with pancreatic cancer. And also, people who consume large amounts of alcohol, unfortunately, can cause this condition known as pancreatitis, which is inflammation of the pancreas, and hence that increases one's risk of pancreatic cancer. uh, and also diabetes. So one with diabetes is indeed at an increased risk of developing pancreatic cancer later in life. And also, as we can remember, the pancreas is also an organ that produces insulin. So if one suddenly develops diabetes very suddenly later in adulthood, accompanied with some other early signs of pancreas cancer, such as severe weight loss, jaundice, and also poor appetite, and that could perhaps be an early symptom of pancreatic cancer. So if you have any loved ones or any family member who may have this, maybe it may be important then also to highlight to the doctor or bring him or her to see a doctor early. And as I mentioned earlier, inflammation of the pancreas, otherwise known as pancreatitis, it is typically a very painful pancreatic disease. Itself, it is not cancer, but pancreatitis in a very long term, that means chronic pancreatitis can actually increase one's risk of developing pancreatic cancer. And also certain industries where you will be exposed to chemicals such as pesticides, benzene, dyes, and petrochemicals actually may increase one's risk of developing pancreatic cancer. So these are some of the potentially reversible risk factors that we know of that are associated with pancreatic cancer. So then the very important question that a lot of patients ask, because there are a lot of health screening packages available nowadays. So then, if this cancer is such a little cancer with such aggressive behavior, is screening then important? So the most important question is there actually a screening test for pancreatic cancer? So unfortunately, there's actually no real single diagnostic test that can tell anyone if you have pancreatic cancer. And unlike for breast cancer and colon cancer, there's actually no real recommended screening route that has been proven to actually lower the risk of dying from pancreatic cancer. And a lot of patients or a lot of relatives actually do ask me, how about the pancreatic cancer blood test? So we do know that there is this test, this protein known as CA19-9. It is a tumor marker. It is a protein that can be detected in your blood. But however, this blood test is used more commonly for us to be able to stage patients with pancreas cancer and also to follow their cancer behavior and response to treatment. If you do have low levels of CA19-9, that may not mean that you do not have pancreas cancer. So I repeat again, if you do have low levels of CA19-9 on your health screening, it may not mean that you do not have pancreas cancer, which is the reason why it cannot be used very safely as a screening test. However, if you do go for health screening and your pancreatic cancer blood test marker is very, very high, that is also a red flag that has to be investigated further, and you have to consult with a specialist who can then advise you how to proceed if you do have an elevated CA19-9 on your blood test. So how about screening for patients who are at high risk for pancreatic cancer? So these patients typically are those with very strong family history of pancreas cancer, or they are already known to carry a gene in their blood. That means it's a germline mutation, and this puts them at a higher risk of developing pancreatic cancer. So while there are no very widely accepted protocols for pancreatic cancer screening, most doctors do recommend screening individuals with a very strong family history of this type of pancreatic cancers at age 50 or 10 years younger than the earliest pancreatic cancer diagnosis in the family. So this, as I repeat, these typically are the patients with a very strong family history of pancreatic cancer, or they already are known to carry a gene mutation that puts them at a higher risk of developing cancer. So next, we will talk about what are some of the signs and symptoms of pancreatic cancer. So among the medical professionals and a lot of people who have personal encounters with pancreatic cancer, we do know that unfortunately this disease, the main reason why it is so aggressive is because it presents fairly late. It usually does not have very early signs or symptoms, but if one has some of these signs, it's a high time to go and see a doctor and seek medical attention. So jaundice. So typically people associate jaundice with liver problems, right? Because this is liver produces your bilirubin, which is the yellow color substance that can cause yellowing of your skin, eyes, and so on. But people with pancreatic cancer can also develop jaundice. It is not because the pancreas has affected the liver function, but because pancreatic cancer, typically the location that it sits, it actually blocks the drainage of this bilirubin that is being cleared from your liver into your intestine. So hence, you people with pancreatic cancer very typically present with jaundice. So as you can see in the picture over here, some patients may have a yellowing of the eyes, yellowing of the skin, and together with that, you can have very dark colored urine like teh, like your tea without milk, that kind of color. Or some people may have very, very pale colored stools. It's like really your stools don't look like the typical kind of color, look very oily and very pale. And some people have itchy skin because this color pigment actually accumulates under your skin and makes your skin very itchy. Some patients may have pain in the abdomen, very unexplained weight loss, even though they may be eating okay, but your weight starts to plummet quite significantly. And you have this abdominal distension and bloatedness that you really cannot explain why. Some other people also have loss of appetite, nausea and vomiting, as well as not very common, but some patients may have this fever with shivering and sweat that cannot be explained by any other common infections and such. So investigation, typically we would do blood tests, and of course because people will be jaundiced, so typically we will do a liver test that will test your jaundice level. We would also do the blood test, which is known as CA19-9. This is really, by then, if you had already been diagnosed, we use the CA19-9 not as a screening test, but as a gauge for how serious your condition is, and also for us to be able to use it as a tracker to see how well you respond to treatment. And very importantly, for any kind of cancer, we need to get a specimen of the tumor to be able to allow us to diagnose the cancer that you have. So typically, we do have to do a biopsy. And you can see over here, the scope. This is what we call an endoscope. It basically goes through the mouth into the stomach, and it actually reaches this area near your stomach. And what the procedure is, or the doctor involved, they can then do an ultrasound, which would then allow them to put a tiny needle in to biopsy the pancreas. Sounds a little bit complicated, but that's precisely the reason why sometimes pancreas cancers present very late, because it is an organ that is embedded fairly deeper inside behind your stomach, which is why by the time most people present with symptoms of cancer, the tumor would have had to grow to quite a size. And also trying to get a biopsy of the tumors in the pancreas can be a little bit challenging. Hence, this procedure usually has to be done. And of course, to be able to stage the cancer and have a very good look at how the tumor has affected the surrounding organs, we usually need to do scans. Typically, we will do either a CT scan or a PET-CT scan, and also an MRI scan of the pancreas to have a very good look at that area and see whether the tumor can actually be taken out. And the more complicated test would then be a molecular test. This molecular test is typically tested on the tumor so that we can have a better understanding on the behavior of your type of tumor, and hence be able to tailor the treatment according to what is the most appropriate and work the best for you. And of course, we would also do genetic counseling and testing in certain patients with pancreas cancer, especially if they have a strong family history or if they are very young. So about only about approximately 20% or maybe a little bit less of patients present with potentially resectable disease, which means the cancer can be taken out, which means 80% of them actually present with cancer that cannot be removed. And unfortunately, about half of all the patients actually present with metastatic disease, i.e. stage 4 pancreas cancer. Staging of pancreas cancer is actually based on a typical cancer staging system that we know as TNM staging, tumor size, number of lymph nodes involved, and whether there's any metastasis, meaning whether the cancer has spread beyond the original organs and lymph nodes. But more importantly, for pancreas cancer, what is very important is, can the tumor be removed? If the tumor can be removed, generally the outcomes are better. So the clinical stages for patients with pancreas cancer include whether it's resectable, borderline resectable, unresectable, or metastatic. So we'll cover a little bit more with some diagrams and such, so it's easier for everyone to understand. And as I mentioned earlier, CA19-9 is a tumor marker that we typically use for helping us diagnose and assessing treatment response in patients. So this this pictorials over here basically shows us the various stages of pancreas cancer. So this is the pancreas organ that is located very near the liver. So you can imagine if, let's say, the tumor does grow to a very big size, it actually blocks the drainage of some of the liver system, and hence that's why some people get jaundice. So this in this pictorial, you can see the tumor is really localized only within the pancreas. So this is what we call resectable. And these are typically patients who are in stage 1 and stage 2. Stage 3 pancreas cancer, however, then falls into the category of borderline resectable or locally advanced unresectable. The main reason why is because the tumor sits over here and it hugs some of the very important blood vessels that supplies several important organs in our abdominal cavity, i.e. your intestines and all that. So these are some important vessels that cannot be cut. If they are cut, you will not get enough blood supply to your intestines and such, and that is not very ideal or compatible with life. So which is why it makes surgery for pancreas cancer very challenging. And of course, stage 4 over here, you can see the pancreas has a tumor, but it has also spread to another organ nearby, which is the liver. And hence, this is what we call metastatic cancer, where the cancer has spread beyond its original organ. And surgery, of course, is not possible. And it is a lot more advanced than what we would hope for. So usually in this stage, we would usually use mainly chemotherapy to be able to control the cancer and offer symptomatic relief from the cancer. So this really is just not to scare people, but more like a table to show why pancreatic cancer is quite scary. So we are comparing a table over here, which is the 5-year survival rate for pancreatic cancer, versus a more common cancer known as colon cancer, 5-year relative survival rate. So you can see for pancreatic cancers, even for stage 1 and 2, 5-year relative survival rate is about 40%, whereas for similar localized disease in colon cancer, it's about 90%. So it's quite different and a lot lower for pancreatic cancer. So because it's a lot more aggressive. So patients with stage 3 pancreatic cancer, survival rates is about close to 15% versus that of about 70% in colon cancer. And stage 4, of course, the numbers drop quite tremendously. So even all the stages kind of combined, 5-year relative survival rate for pancreatic cancer is still quite poor at the moment. So of course, there is always a lot of research being done to see how we can improve the outcomes in pancreatic cancer. I think we have improved over the years, but I think if we have the means of being able to pick up pancreatic cancer earlier, it may offer us a better chance. And of course, if one can reduce your own risk factors associated with pancreatic cancer, that will be even better. So then moving on to treatment modalities for pancreas cancer. Really, it's a form of cancer that requires multiple modality of treatment. So as with several other different types of cancers, surgery, if the tumor is amenable to surgery, we use a lot of chemotherapy as well. And for some patients who may have tumors that are causing them quite a bit of pain or other symptoms like bleeding, we do offer radiation as well. And of course, for people with more advanced pancreatic cancer, and if they do have a molecular target within the tumor that can be targeted, we also use targeted therapy. And more recently, in a relatively small group of patients who are suitable for immunotherapy, they would also be put then on immunotherapy for treatment of their pancreatic cancer. So then this table really shows us a breakdown of the general treatment principles for pancreatic cancer. So as we mentioned earlier, resectable meaning localized pancreatic cancers means those patients have the tumor localized mainly within their pancreas and they can be resected. Then the general rule of thumb is we will undergo surgery followed by chemotherapy. However, if the tumor is locally advanced or borderline resectable, usually we would consider offering chemotherapy to downsize the tumor to make it smaller before going for surgery. So then it would make the tumor easier to operate for the patients, and also then the risk hopefully is not as high. And of course, patients with cancers that have spread beyond the original organ, surgery is already not possible. And definitely the treatment intent for the cancer treatment is really to control the cancer. Then they would be mainly receiving chemotherapy to control the cancer. So over here you can see this thing. What is this thing called the ECOG status? So as we had mentioned earlier, pancreatic cancer, by the time a lot of people present, they may have a lot of symptoms. They may be fairly weak, and also several patients with pancreatic cancer are fairly elderly. So besides just talking about the cancer, we also have to look at each individual and how fit they are to be able to undergo what looks like fairly rigorous treatment with surgery, chemotherapy, and so on. And if indeed they are already very beaten by the cancer and undergoing all this treatment will not do them any good, then the doctors will then discuss whether it is a better idea to then offer what we call best supportive care instead of making them go through all the treatment that they may not be able to tolerate. So yeah, so then really just a little bit of terminology, if you may hear about doctors talking about it. Um, really, as I mentioned earlier, resectability, that means whether the tumor can be resected and taken out is actually a very key determinant in the outcome for patients with pancreatic cancer. And we use what we call adjuvant and neoadjuvant treatment strategies together with surgery to improve outcome. Usually, adjuvant and neoadjuvant treatments involve mainly chemotherapy. Adjuvant therapy means the treatment is given after the surgery in order to minimize the chance of the cancer recurring. Neoadjuvant therapy means before the surgery, the chemotherapy is usually given to reduce the size of the tumor to allow for a more successful surgery. So, general big idea concept. That is how we justify why we want to give a certain forms of treatment and why we name the treatments like this. So this may be a little bit graphic, but pancreatic cancer surgery, you may, if let's say you have any loved one who has undergone this kind of surgery, you may hear doctors talking about this thing called Whipple. So the Whipple procedure is actually a surgery known as pancreatical duodenectomy. It is named after the surgeon who invented this form of surgery. So as you can see over here, it's actually a fairly complicated surgery. So itself, the surgery takes a fairly long time, and also it has to be done by a surgeon who is very well versed in the care of patients with pancreatic cancer. As you can see over here, this is where the tumor sits. So when you remove the tumor head over here, you will also have to remove part of the what we call the biliary tree, the bile duct, and you also have to cut part of the stomach because the pancreas is also stuck to the stomach as well. So then after you remove all of these, you will then have to connect the bile duct over here to the small intestine, the remaining pancreas to the small intestine as well as the stomach. So the surgery does take quite some time to be able to complete, and also usually the patients would take some time to recover after such a big surgery. So then moving on to what we have talked about, adjuvant and neoadjuvant chemotherapy. So These are given in the setting where patients have early stage uh, pancreatic cancer, meaning they are stage 1 and stage 2. So in this scenario, usually the tumor can be removed. And after the removal of the tumor, usually we give adjuvant chemotherapy to reduce the risk of the cancer recurring. So the big numbers here, 1, 2, or 3, is really the general concept on how we offer chemotherapy to patients with pancreatic cancer. For individuals who are fit, who are very fit and very young, they are likely to be able to tolerate the chemotherapy. We actually give a triplet chemotherapy. Bearing in mind FOLFIRINOX is the triplet chemotherapy tree over here. It has 3 different chemotherapeutic agents in one. So as you can imagine, the side effects would be definitely more. But that also means that, and has been proven that FOLFIRINOX, the triplet chemotherapy, is better than 1 or 2 chemotherapy generally. So for those who are somewhat in between, we would then offer 2 chemotherapy medications, otherwise known as gemcitabine and capecitabine. And of course, for the older patients who have just barely been able to tolerate the surgery and they have recovered, and we are quite worried that they may not be able to tolerate, then we will offer single agent chemotherapy with what we call gemcitabine. So these are all chemotherapy medications. They have their own class of side effects and all that. But as with most chemotherapies, we will usually advise people not to generalize, but to speak to their managing doctor to explain a little bit more about what are the side effects to watch out for when they're undergoing that form of treatment. So then as a parallel, when we talk about metastatic pancreatic cancer, meaning people with more advanced pancreatic cancer, bearing in mind these cancers, they have already spread to other organs. So the treatment outcomes may not be so ideal. Mainly to offer control of the cancer, disease control, so that the patients do not have a lot of symptoms. So the goals of treatment should be really discussed very carefully and to understand what patients want before the treatment is initiated. And similarly, when we initiate these treatments, we would have to look at one's individual functional status and also age. So treatment is fairly similar. It's also the same logic of 1, 2, and 3, except that the accompanying arm for the doublet chemotherapy is a little bit different. Instead of gemcitabine and capecitabine, we have gemcitabine and Abraxane. So this is typically what we call 1, 2, and 3. These are options for the first line chemotherapy. Then subsequent line, we would then have to see what the patient has received earlier. There are some other medications, chemo options in patients who have had first line, responded well, but may have the cancer may have like recurred or relapsed or worsened. Then other future lines of treatment would be what we call liposomal irinotecan, or also then there are some what we call clinical trials where there are newer medications that are available for patients that may not be available commercially, but these are in the form of clinical trials where newer medications can be offered to patients in a very controlled environment. Later, we will cover a little bit more about other newer forms of treatment that are for a smaller subgroup of patients who are tested to have certain molecular mutations. So then that brings us to the novel treatment options that we were talking about. So this may be a fairly busy slide that is a bit scientific. So we always talk about molecular sequencing in cancers. So very simply put, really the tumor that you had a biopsy done or removed, the tumor is typically kept in the laboratory of the hospital where the surgery or the biopsy is done. And these tumors can then be sent for a molecular testing to be to allow us to be able to understand what are the mutations within these cancer cells in hope to be able to find certain mutations where we have medications to allow us to treat. So fortunately, the fact is that more than 25% of pancreatic cancers have actionable molecular biomarkers. But the ones with very specific medications that can be treated, as you can see over here, is actually very small numbers. majority of them are what we call deficient DNA repair mutation, meaning for some reason these the cells within your body have developed certain mutations that are unable to repair DNA. So then that predisposes all these cells to developing cancer and all that. And what a lot of research and such has discovered is that for this particular group of patients, typically they will respond a lot better to what we call platinum-based chemotherapy. That means this would, if we do the molecular sequencing, it would actually affect or it would allow the oncologist to know what is the type of chemotherapy that is more suitable for you. So that's simply what it is. So the current recommendation is that molecular sequencing is really recommended for patients with metastatic, meaning stage 4 pancreas cancer, as well as locally advanced pancreatic cancer where you cannot remove the tumor. So that is up to 80% of the pancreatic cancer patients to be able to allow us to identify uncommon but actionable mutation. So then, as I mentioned, some mutations then allow us to be able to identify who are the ones who will benefit better from what type of chemotherapy. So typically for people with DDR deficiency, we usually would use what we call platinum-based chemotherapy to treat uh, this type of pancreatic cancers. And for FOLFIRINOX, in that sense, it is a platinum-based chemotherapy which would be able to help majority of these patients. So then, moving on to talking about slightly rarer mutations, but these are more commonly what we know as inherited mutations called BRCA, more commonly in breast cancer patients. So what we kind of do need to know is there are two things. People can have mutations within the tumor but not carry in the family line. So this in this scenario, we are talking about patients with tumors that are carried in the tumor but may not be in the family line. But a small percentage of them, 5 to 7% of patients with pancreatic cancer can have family line mutation. A lot more common in people who are Ashkenazi Jews, and also those who have a strong family history, family history of pancreatic cancer, as well as those with a strong family history of breast and ovarian cancer. So up to about 40% of patients who have germline mutation carriers do not have a family history of breast and ovarian cancer. They may have other things like pancreatic cancer. Why is Angelina Jolie over here? So Angelina Jolie is very well-known Hollywood actress, of course, but she's also very well-known for the fact that she had what we call BRCA1 mutation. BRCA is BRCA1 mutation. It is a germline mutation that's carried in the family line, and that predisposes women to developing breast and ovarian cancer. So Angelina, as a result, she has taken the test and known that she had carried the mutation, so she went for fairly aggressive surgery to remove her breast and ovary such that her children will never have to see her develop cancer and she will pass away in their lifetime. So she did that and it was a very big thing and all that. So that's why BRCA mutations is fairly well known in the field of breast and ovarian cancer. But what we also kind of need to know is BRCA mutations also associated with rarer cancers such as pancreatic cancer. So then, germline testing for hereditary cancer syndromes is recommended for people with confirmed pancreatic cancer, especially those who are very young and those with very strong family history of cancer. So then, for people who have BRCA mutation, BRCA mutation, this medication known as olaparib is being used in breast and ovarian cancer patients with very good results. So then, of course, scientists will then look at trying to use this in treatment of patients with stage 4 pancreas cancer. But unfortunately, usually when we see a clinical trial result when the lines are hugging very closely, it means whether you add the medication or you don't add, it doesn't change the outcome. So it is not as good a result as what we had hoped for. And they had also looked at other forms of this medication, so they are also still ineffective. But there are still a lot of research ongoing in hope to be able to figure out what is it that can be a life-changing thing for a lot of these patients with pancreatic cancer and BRCA mutation. So this is really a table, a very crowded table, but it just really shows that there are benefits in doing this molecular mutations testing, even though the actual number of people being picked up with targetable mutations is not very high. But you can see over here, the people with mutations that are matched generally did a lot better than in the blue line here. These are people who have mutations with treatment that are matched, and the red line over here is those that are unmatched. And of course, there are some who have nothing found now. So those who are matched actually did better. So this is something to kind of highlight a point overall that we should really be testing and trying to find out whether these patients, whether patients with pancreatic cancers have molecular mutations that can allow us to target. So this is really like a summary slide to kind of highlight a couple of things. There are additional markers or mutations that we have treatment options available for patients with pancreatic cancers. So you can see over here that the frequencies are not very high, but these, whether the patient has MSI high or tumor mutational burden more than 10, it would allow us to use what a lot of people have heard of in this day and age, immunotherapy. So immunotherapy has kind of revolutionized treatment for certain types of cancers. But pancreatic cancer, as you can see, it does benefit a very small percentage. That means out of 100 patients, you may only have that one patient who may have who may benefit from immunotherapy, but it is still very important because it would then give them treatment benefit that will be much better than typical chemotherapy as it is. So at the moment, this mutational testing have been approved, and if the patient do test positive for all that, there is already approval for patients to utilize immunotherapy for that. And of course, rarer mutations known as NTRK with medications available. So the ones that we've highlighted over here in yellow are those that if the patient do have a mutation tested to be positive and the medication is currently available and also approved on our cancer drug list in Singapore. So there are quite, as you can see over here, there are quite a couple of other not very common mutations, but it is being investigated in very early studies and clinical trials to in hope to be able to find certain the medications that can match the mutations and help our patients. So last but not least, this was kind of published earlier in June this year. Very exciting. People may have heard in the news about what we call CAR T cell therapy. It is a form of immunotherapy that has been shown to be very beneficial in a lot of the children blood cancers, meaning leukemia and such. And also it is being research is being done to look at different types of cancers, including pancreatic cancer. So this is really a patient who has pancreatic cancer and has a particular type of mutation known as a KRAS mutation. And what happens is, so these cells are basically detected and it's brought to a lab where you do generate or you actually create cells that would be able to target this particular protein or antigen in the body. And then the cells are being infused back to the patient to fight the cancer. So you can see over here what this paper had shown was that before the treatment, then after the treatment, you can see the tumor has really disappeared and remained pretty much very small. So the outcome seems to be really quite good and quite encouraging. So this is really like the first one of the first case in the world. So it has been reported in a very reputable medical journal. So this is very exciting. However, CAR T cell therapy for pancreatic cancer is not available commercially yet. Really, there are some clinical trials around the world that are looking, recruiting patients to look at whether this form of treatment is really truly suitable for all patients with pancreatic cancer. But these are exciting times ahead, and we are quite happy that there is this possibility of a newer form of treatment for patients with advanced pancreatic cancer. So last but not least, really, pancreatic cancers, a lot of the patients have a lot of symptoms ranging from tiredness, fatigue, to um, not being able to absorb the nutrition from their food very well. So they may require enzyme replacement. Then some people may have jaundice, so they may need to have stents put in to be able to allow them to be not so jaundiced. And also some of them, some people may not be able to eat very well because the stomach is being blocked by the tumor, so you may need stent. A lot of patients with pancreatic cancer have quite a bit of pain, so pain control is very important. There's also weight loss, poor appetite. So there are some nutritional supplements and appetite stimulants that we can use. Depression is also very common, mainly because of how the disease progresses and such. And also a lot of patients with pancreas cancers may have thicker blood. So their blood doesn't flow as well. They may actually need blood thinning medications if they do have a blockage of their vein. So really proactive management and relief of pancreatic cancer related symptoms can actually improve the quality of life of most patients with pancreatic cancer. So we, as physicians treating, we usually bear this in mind we're quite aware of it, and we usually take very proactive action to help patients with pancreatic cancers with their symptoms alongside with treating the cancer. So then a lot of patients would then say, I saw this thing online. It says this special medicine is very good for curing my cancer and so on. But really, there's a lot of information out there that may or may not be reliable. So this slide really has some of the very reliable online sources of information that you can look at and get reliable information from. So a lot of patients would ask, oh, can I take this herb? Can I take this supplement? Does it interact with my chemo and not? So one of the websites that I found fairly useful is a website that is being curated by, in Singapore, we do have a website that is being curated by a National Cancer Center in SGH. It's also quite good, but I guess the Memorial Sloan Kettering Cancer Center website has been curated a bit longer, so they have actually quite a lot like about 200 plus and maybe 300 plus different herbs. So it's something that you can take reference from if you want to start yourself on this supplement and you're not sure. But of course, besides looking at this, you should also bring it to your doctor and just double confirm in case, you don't really understand what exactly they're writing or you misunderstand. So that's always the best to double check with your doctor. But this is a good website to have a bit of reference. So then, after all that talk, really some of the take-home points. Pancreatic cancer is an aggressive cancer, but it is diagnosed in early stages. There is still a chance for cure. So that's something that we really kind of have to remember. And knowing your risk factors and minimizing the correctable ones would really potentially reduce your risk. So unfortunately, health screening has not really been proven to be effective for pancreatic cancer, but for selected individuals who have a hereditary cancer syndrome, doctors, we do recommend that if you are above 50 or 10 years, at 10 years younger than the youngest individual in your family with pancreatic cancer, you should consider going for screening. And then recognition of early signs of pancreatic cancer and seeking medical attention is crucial, very important. So as we kind of mentioned earlier, pancreatic cancer treatment usually involves more than one form of treatment. So the treatment process can be a little bit long, but really we would usually journey with patients through it to help you get through it and understand why is it that you have to go through all that. And management of the symptoms of pancreatic cancer is very important to optimize one's quality of life. Then last but not least, with further advances in medical treatment, we hope to be able to further improve the outcome of patients with pancreatic cancer. So this is pretty much my last slide to just kind of highlight again what are the risk factors that one should watch out for, and what are some of those that potentially may be reversible, and some symptoms of pancreas cancer to watch out for, and what and really if you do have any of the above, don't feel shy or whatever, just seek some medical attention. It's always better than leaving it alone. Okay, then with this thank you for listening to my talk. I think may have gone on a little bit longer, so I'll be quite happy to answer questions in the Q&A later. And this is my email address as well if you have any questions. So with this, I will probably hand the session back to Gary.
Hi, Dr. Pang. Thank you so
Yeah,
much. That
hi.
was a lot of information, a lot of great
A lot.
information.
Yeah.
Yes, very, very much
Mm,
so. I hope that
mm,
everybody here has been
mm,
enlightened. I definitely have, and it's
mm,
it's good that although it is quite a serious cancer, that yes, there are
mm,
some profiling and things that you shared earlier as well, with the
definitely.
immuno treatments and things like that too that can help. So I'm
Mm-hmm.
very glad to hear that. Now we do have a number of questions.
Yeah.
Thank you so much. If you do have any more questions, please add it into the chat now. This is kind of your last chance. I'm going to start going through some questions if you don't mind, Dr. Pang. So
Yeah.
we had a couple of questions sort of about, um,
Mm-hmm.
you know, family history and whether it's hereditary.
Mm-hmm.
Uh, and I know you did mention a little bit about that, but was there something that you could just sum up in a very short phrase just to reaffirm what
Okay.
is happening,
Yeah.
yeah, with pancreatic cancer and sort of family history there?
Yeah. So in general, if one has perhaps only one family member with pancreatic cancer, it may not mean that you have a strong family history. But if you do have more than one individual, or if you do have several individuals in your family, and when we talk about family, it's maternal, paternal family, and three generations. If you do have a very strong family history of any different types of cancers, and you kind of put it together, and it sounds very suspicious, then it really has, as a family, you really have to kind of evaluate what is the possibility of you having a inheritable kind of cancer. And also, really, if you are not sure, you can always bring back to your family physician and talk through the history with your family physician. Then they can guide you along to whether there can be genetic testing that can be done with some counseling, as well as what is your risk of developing this form of cancer, and what are some of the screening recommendations that can be done under very guided premises.
Okay, thank you.
Yeah, no problem.
And yes, so that
Mm,
very clear with that.
mm,
And in terms of you mentioned sort of about insulin, right? With
mm,
uh, and how that's affected because of course that's the pancreas there. So
mm,
if a patient was to be
mm,
diabetic, what are there other signs and symptoms that it could actually point to pancreatic cancer? I mean, I know you've sort of shared the whole
mm,
list of
mm.
signs and symptoms there.
Yeah.
Is there something in particular for diabetics that they might want to look out with?
Yeah, so I think diabetes is actually very common in Singapore. So I probably have to highlight the fact that a majority of patients who are diabetics do not have pancreatic cancer. But of course, if one gets diagnosed with diabetes very suddenly, and also this is accompanied with very severe weight loss, and all the other signs of early pancreatic, all the other early signs of pancreatic cancer, such as abdominal bloatedness, jaundice, so on and so forth, or you just feel that something is not right, always bring it up to your doctors, because as doctors, we do have that at the back of our mind. If one is diagnosed with very severe diabetes very suddenly, it may be a symptom of pancreatic cancer. So, as doctors, we do know, but as patients, if you are diagnosed and you are worried, always bring it up to discuss with your doctor, and that would probably allow you to clear your doubts and give you a peace of mind.
Mm. Yeah,
Yeah.
thank you. So,
Mm,
just again, sort of a little bit more on symptoms. There have been
mm.
some, comments and a little bit of a chat happening through the comment section,
Yep.
just
Yep.
about people,
Mm.
unfortunately, family members who have passed away from pancreatic
Yeah.
cancer,
Yeah.
and
Mm.
by the time it was already at stage 4, it was kind of like, about a year from diagnosis to final departure,
Mm.
and that a few people sort of commented, is it just the stomach pain that the gastric pain or the stomach pain that was the
Yeah.
main symptom? Is that
Yeah.
really just the main symptom that most people will get?
Yes. So, for patients who present with pancreatic cancers, either they present with jaundice, or they present with a very typical form of what we call abdominal pain, that is right in the middle, and it actually goes to the back. So most of the time, people do have gastritis or gastric pains that they come and go. They should not be so severe such that it affects you every day, and it affects you in your sleep, and it affects you so much that you cannot even eat properly. And if anyone were to have pain that serious, besides suspecting pancreatic cancer, it's really time to get medical attention, because this type of pain that is in the middle goes to the back is very classical of pancreas pain. And one of the common reasons for that is typically pancreatic cancer, especially in elderly. So I do see in the comment section that some members of the audience have mentioned about grandmother getting pancreatic cancer and presenting with that kind of pain. So elderly with very severe pain like this, we should always it's a red flag that really should sound some alarm bells for you to seek medical attention for that to check it out.
That's
Yeah,
very important, especially like you
yeah,
said, pain that wakes you up at night or that
yes,
stops you from sleeping
exactly.
and all that. Yeah, that's
Mm-hmm.
definitely valuable, and that's very different to if somebody did have just a gastric, you know,
Precisely, precisely.
a
Yeah.
reflux or some other gastric sort of related
Mm-hmm.
issue. Yeah. Okay,
Yeah.
great. Um, so then speaking a bit more about again gastric and stuff, diets. I know you flashed a slide there with maybe some herbs or some supplements that people could look at. Is there a particular diet like a keto diet or something that could help support people through chemo or some sort of other dietary advice or direction if people are going through treatment? Do you have any advice on that?
Well, so typically, as I think everybody has slightly different practices, but most of the physicians managing patients with pancreatic cancer, we usually work very closely with the dietitians. Not so much because uh, it's more because a lot of patients with pancreatic cancer, they lose a lot of weight. So they do need a fairly protein-rich diet to be able to help them be able to gain some weight and have energy to be able to tolerate the treatment. And also, as we mentioned, some patients present with diabetes as part of the presentation for pancreatic cancer. So, because of that, we do have to work quite carefully. You have to take food that gives you energy, but you cannot take things that are too sweet because it will then send your diabetes roaring and doing quite badly. So typically, we will advise patients to take foods that are more protein rich and that would give them energy. And if let's say they can't tolerate taking very solid food, we will usually recommend taking milk supplements that are usually recommended by our dietitian, that they really tailor it according to what are the caloric requirements of each individual.
Yeah, great.
Yeah.
And so you mentioned about not so
Mm,
sweet. Somebody, again, a little follow-on comment was,
yeah.
particularly, foods or fruits. So are
Mm.
fruits also recommended, or do they fall into the maybe too much sugar side of it and, in moderation or something?
Yeah, fruits as a very big group. In general, most fruits are fine, but there's some fruits or things masquerading as fruits like durian. Durian is really very sweet. It's like more sugar than anything. So generally, most fruits are okay. But I would say there are certain fruits that we would recommend people who are on chemotherapy not to take. That would include things like grapefruit, not grapes, but grapefruit, pomelo, starfruit, because some of these fruits they actually interact with the chemotherapy that patients are receiving. So generally, most other fruits are okay. But if one is undergoing chemotherapy, we would advise patients to purchase the fruits, wash them, cut them at home instead of buying cut fruits from stores and such. It's more for hygiene purposes.
Yeah. Okay.
Yeah,
And so just a little bit more on sort of the diet and
yeah,
the nutrition and sorts of things.
no problem. Mm.
Somebody's asking, uh, maitake, I don't know if I'm even pronouncing it correctly, but maitake and reishi supplements. Have you heard of those? Are they beneficial for anybody with pancreatic cancer?
Maitake and what?
Reishi, yeah.
There are many different types of supplements out there. So I would usually say the brand names mean very little to us because a lot of the supplements have many different minerals and vitamins added. So it probably would be best for one to bring to your treating doctor to have a look and at least just make sure that there is no adverse interactions or effects on your cancer before taking it, because
Mhm.
sometimes some of these supplements may have things added and they may not be uh, very, I mean, a lot of patients would have family and friends who would very kindly buy and purchase this supplement for them. But they may not know that this may not be very suitable for them. So it's quite difficult to tell because there's so many types in the market. So really just bring the bottle and such to check with your doctor. If it's fine, usually they would say go ahead and take it, not an issue.
Mm, thank you.
Yeah.
So, um, let's move on a little bit from the diet. So, a little
Mm,
bit more about the cancer. So,
mm,
uh, well, first thing, maybe pancreatic cysts.
mm.
Could they develop into a cancer?
Okay, that's a very good question. So, usually, there are two types of cysts. So, normal pancreatic cysts, what we call the benign ones, they're usually fairly harmless, and they do not develop into cancers later in life. However, there are certain characteristics. If we do pick up a pancreatic cyst, it would have been seen on some form of imaging, some form of scan. So based on the scans, usually there are certain characteristics that we doctors look out for to allow us to gauge what is the likelihood that it may become cancerous later in life. So I would say most pancreatic cysts are benign. However, there's a small number of them based on the imaging characteristics that may turn cancerous. So this question probably should be then brought back to the doctor who is taking care of you for that to be able to gauge what your risk is and what is the follow-up plan for someone with a pancreatic cyst. So you should not leave that alone, but should always seek advice from your treating doctor to be able to gauge what is your risk in the long run.
Okay, thank you.
Yeah.
And so, again, a little bit more about the cancer and these
Sure.
testing and things that you're talking about. So, a few questions
Mhm,
there. Um, a very specific question here. I'm not sure if you're able to answer it, but let
mhm.
us know if you can or if you can't. So,
Sure.
the question was for those who fall out of the bell curve for the CA19
Mm.
um, for many years with readings ranging from 40 to 110. Does that mean they have a higher chance to get pancreatic cancer?
Um, Okay, that's a really good question. So I would assume an individual like this would have gone for health screening and such.
Yes.
So that's the thing about health screening because some people may have abnormal values but they do not have cancer. So that can be quite tricky. But I would
Yeah.
not say that typically most people do not have elevated CA19-9 unless there is pancreatic cancers or some other form of rarer cancers that can elevate this value. So I would say for an individual with a level like this, it would probably warrant a proper workup with scans, of course, with advice and guidance from a doctor to make sure that nothing is missed. And also, probably a follow up plan to ensure that because our scans have a certain level of sensitivity, we have very sensitive scans such as PET scan and everything, but that may not guarantee you 100%. So when this kind of levels are like this, it's always good to kind of discuss with your doctor how often should you go for your test and whether you need to have an interval scans and all that to really make sure that you are in the clear and it's just you do just happen to fall out of the bell curve and you just have these elevated levels but you do not have cancer. Those I guess that's the most important thing in this practice lah. Yeah.
Thank you. So, yeah, so a little bit more about this testing and that sort of thing. A
Sure.
very sort of blunt, simple question first, and you're welcome to say Oncocare Cancer Center too. But which hospital is the best in the treatment for pancreatic cancer, or that you might recommend?
Ayo.
Besides the kind of course, I mean, who else? I mean,
so
you heard
so
my bio earlier.
yeah. So I mean, I would say, in general, Singapore has a very well developed healthcare system. So for the general public and majority of the population, the government has set aside a MediSave and MediShield plan, which helps everyone, regardless of their earnings and income bracket, to be able to receive appropriate cancer treatment. So I would say for people who need to get treatment for cancers, generally, so long as you are being treated in a hospital with proper cancer treatment facilities, that would be more than sufficient for you to get the standard care for pancreatic cancers. So that includes the bigger cancer hospitals in Singapore, such as National Cancer Center or NUH. So these are the main cancer hospitals in the main cancer centers in Singapore. Then of course, Oncocare and other cancer centers, we then are in the private hospitals. So then that would be, for example, in Mount Elizabeth, Gleneagles, and so on. So in Singapore, I would just probably, as a general statement, say that we do have a very good healthcare system. So there's really not that much worry that you will fall through the cracks and such, so long as you are aware and you seek medical attention early. So I hope that answers the question.
Yes, definitely. And I know to all the viewers as well, there are a lot of questions that we want to get through. So I hope you guys don't mind just hanging around for a little bit more. We might just try and get through a few more questions. Do you have time for a couple more questions, Dr. Pan?
Yeah, sure, not a problem.
Yeah. Okay,
Happy to
great.
take more questions.
Great. So, again, you mentioned sort of the different hospitals and that sort of thing. So, where can one go and get these genetic testings, the ones that you mentioned earlier, and these profiling? Maybe an idea of what the cost might be like, and can we just as a public go and request that, or do we need to get a referral for that, or what's the process?
So at the moment, I think because there are a lot of commercial platforms that talk about genetic testing, understand your ancestry and things like that. That is a little bit different from what we are talking about here, which is genetic testing to see what is your risk of developing cancers and such. And typically, we would advise patients not to just go pay money for a test without understanding the implication. Typically, we would advise people to undergo genetic counseling before going for the test because it has a very broad implication, meaning if you are tested to indeed have a inheritable form of genetic mutation that predisposes you to cancer, that would also have implications on your family, and it will also have implications on your children, and subsequently it would also have implications on you as an individual purchasing insurance and such. So you have it's always good to understand what your own risk is, but before going ahead and do the test, you do need to understand what the implications was before proceeding. So Oncocare Cancer Center, we do genetic testing and counseling. The other cancer centers as well in Singapore, they also do have proper genetic counseling and testing. If patients or family members are interested, we are always happy to explain more before one takes the step out to do the genetic testing.
Yeah, that's a very, very valid point. I mean, it's one thing to kind of know, but yeah, the implications
Yeah,
and that trickle
exactly.
effect, that maybe the stress and all the rest of it. I mean, it can be,
Precisely,
I'm sure,
precisely.
quite overwhelming. Yeah, maybe for some people to
It would
receive
be,
some
it would be.
information.
Yeah,
Yeah.
yeah.
Okay, so if we just continue the testing, I know you've flashed up a lot of slides about
Mm.
who should go for the screenings,
Mm-hmm.
and like what sort of screening methods. So can you just do a real quick recap if you need to
Okay,
share your slide again, maybe just a 30-second recap on maybe
sure.
best screening methods, or who would be beneficial, because
Mm-hmm.
there's a few people asking for that again. So if you don't mind just
Sure,
spending like 30 seconds to do
sure,
that, that'd be great.
sure. So in the general public, as a general population, we do not entirely recommend cancer screening for pancreatic cancer because there has not been a test that is proven to be able to detect pancreatic cancer early and accurately. So when we need a test like that, that really means that if we do a test and it's negative, the likelihood of you not having the cancer is very, very low. And if it's positive, the likelihood of you having the test is high and you really should seek medical attention. The worst case scenario we are really worried about are the situations where if you do test negative and you think that you're in the clear and you do have some symptoms, you do not get help. So most of the general population, we do not routinely recommend pancreatic cancer screening. However, for those people who have a very strong cancer history of cancer family history of pancreatic cancer, then we would recommend people who are above 50 or 10 years younger than the youngest pancreatic cancer history, pancreatic cancer person in your family. For example, that person gets diagnosed at 60, you should get tested at 50. Or if that person gets diagnosed at 50, you should get tested at 40. And so this really should be done in consultation with your doctor and such. And for individuals like this, the testing would usually require you to do MRI tests and also some invasive endoscopic tests and so on. So that really has to be discussed thoroughly before going for the test.
Great.
Sorry, I
Thank you
think
so much for
that took
covering.
more than 30 seconds, but
That's
yeah.
all right, but that was spot on. And again,
Yeah.
it is
Mm,
unfortunate that
mm,
yeah, it is unfortunate that there is no specific test, like you said, that we can
mm,
detect this early. And
mm,
if you had followed the comments before, you realize that yeah, there were a few people that actually were talking about the
yeah.
fact that it was quite a sudden
Mm,
stage 4 and all the rest of it. So yeah, prevention always better than cure. We're going to wrap up right now, but I just have one final question. I just saw it come in, so thank you for all the questions. I hope I've been able to help you guys get them answered. There is one last little question that I just thought was
okay.
really interesting. So last thing for tonight, there was a doctor at another talk who said that eating the cassava balls in the bubble, I think BBT's bubble tea. I am not
Yeah,
very
it is bubble tea.
bubble tea, right? Okay. So the last question is there any truth to warning of watching out for these bubble tea balls? Um,
In
you know,
general, bubble tea is very high in sugar content. So really, chronic intake of like bubble tea, it really increases your risk of metabolic syndrome, i.e. increases your risk of developing diabetes. And as it is, we already know that having diabetes puts you at increased risk of getting pancreatic cancer. So that in general, I think is bad for health. Taking in very moderated amounts once in a while, indulging yourself is fine, but too much of it is never a good thing.
that sounds like everything. So thank you very much for your time. Thank you to all the
Um,
lovely people in the comments. You've got a lot of thanks, Dr. Pang. So I would like everybody to say their thanks to Dr. Pang on the chat. And I'm going to wrap up shortly. So Dr. Pang, thank you so much for taking your time this evening. I know we've extended. I'll invite you to take your leave now.
yeah, thank you,
And
Gary.
thank you very much. And at this point, before everybody leaves, please, look at this next slide right now. I would love to get your feedback from tonight's session. Feedback is extremely important for all of our sessions because we want to know exactly what was good, what was not, what you want to know. So please just spend 20 seconds right now. Pretty please. I know it's late, but you guys had a lot of questions. I really hope we covered them all. Get on that QR code right now. 20 seconds. Please give us your feedback. We'd like to know what you want, what you like. Thank you very much, everybody, for being here this evening. All right, so I hope that you've got the feedback. If you haven't, just check the link in the comments because the next slide, I want to quickly announce our next Facebook Live event is going to be very important. And there was a lot of nutrition questions in the comments before. If you know anybody that needs good nutrition, whether they have cancer or not, I think nutrition is super important for everybody. And again, prevention, guys. So next topic, 10th of December, mark it in your calendars after you finish the feedback, please. Marketing your calendars, 8:30, same place, same time. So right here, Facebook Live. We're going to be having a dietitian, Wong Chai Ling from Farrer Park Hospital. She will be here and helping us out. So please be here and mark that in your calendars, finish up the feedback. And once again, thank you so much for attending this evening. Please like, share, post, recommend our social media pages to everybody, and make sure everybody else knows about our Facebook Live sessions, please. Thanks once again. It's Gary here. It was a pleasure being your host this evening, and I wish you all a very good evening. Thank you.